Hello everyone, I'm Javier Puryear. I am a student at Winston-Salem State University and I am in the Clinical Laboratory Science program. This is Chemical Urinalysis class, and the purpose of this class is to teach you how to use the dipstick test as well as the HCG pregnancy test. Both tests are fairly simple but are used routinely in labs and are very important in everyday lab activities. So the first question I want to ask you is, what's the purpose of urinalysis? Well, urinalysis is analyzing urine. Its purpose is it does a few things. One, urinalysis is very important because of how easy it is to attain a specimen, which is urine. Other tests take a little bit more work, such as getting blood or other bodily fluids take a little bit more work, a little bit more invasive. Urine is readily available, very easy to use, and that's why it's so popular for many tests. Also, what urinalysis is, analyzing urine, they can do things such as monitor diseases, look for certain symptoms. It's used in regular evaluations, and plenty of other things in that realm as well. It can be done chemically, physically, molecularly, or microscopically. So then the other test that we're going to look at is the HCG pregnancy test. And what's the purpose of it? Well, you guessed it, it's to find out if you're pregnant or not. This is done by monitoring HCG, which is a glycoprotein hormone produced by the placenta during the beginning stages of fertilization. It takes around 7 to 10 days to start to see the results of the HCG, and then it just ramps up rapidly after that. So it's a very, very good indicator of early pregnancy, and that's why it's used routinely. It can be detected with urine or serum, but for our purposes, we'll be using the serum version. So what I wanted to go over is the checklist for both and the objectives of both. And by both, I mean the dipstick chemical urinalysis as well as the HCG pregnancy test. So the first thing I'm going to talk about is the objectives for chemical urinalysis. The first thing we want you to know is, what is the purpose of the chemical urinalysis? That is the objective we want to accomplish. The second one is, can you perform a chemical urinalysis? That is the objective of the course. And the last, can you interpret the results of the chemical urinalysis? For the objectives for the HCG pregnancy test, it's fairly similar. What's the purpose of the HCG pregnancy test? Can you perform an HCG pregnancy test? And last but not least, can you interpret the results of the HCG pregnancy test? So I'm going to go over the checklist of both. For the checklist for the chemical urinalysis, the first step is to remove the top from the chemical. Before I go any further, the checklist is my way of monitoring your progress and to see that you have mastery of the material. It's the way at the end of the course we can look at and assess where you are and go from there. And once we follow the checklist, we'll see if you completed everything and see if you mastered the course or not. So once again, the checklist for chemical urinalysis. The first thing I want you to do is you'll remove the test strip and you'll take a test strip out. Make sure you put the lid back on. You don't want contamination from light or other sources to get into the lid. The second checklist would be to dip the test strip for 1 to 2 seconds briefly into the urine, making sure all of the test squares are submerged. You don't want to leave any behind. Everything needs to be tested, so everything should be submerged as well. The next step would be, as you remove it, make sure you drag it along the edge of the cup, getting all excess urine off of the test strip. The next checklist would be to place it adequately, or place it on the ground in a dry spot and set the timer for the adequate amount of time. The last but not least, you would, after the timer has rung, you would check your results to the side of the vial, make sure the colors match up, interpret the results, and then record the results accurately and then present them to the doctor or turn them in. So that's the checklist for chemical urinalysis. And now we move on to the checklist for the HCG pregnancy test. A little simple, but also extremely important. So the first thing you would do is rip open the package that the cassette comes in. The second step would be placing the cassette on a flat, clean surface. It needs to be flat. It needs to be able to move properly. The next step would be to get the pipette, get 3 drops of urine, and place them into the cassette without any air bubbles. Air bubbles can disrupt the whole thing, so you got to make sure you do full drops of urine into the cassette. So the next step after that, you would set the timer for the amount of time. And the final step, you would need to accurately read the results, interpret the results, and record the results. You have the control line and you have the test line. Both are very important. The control line has to be there or the results are invalid. The test line, if you see a line on the test line, congratulations, you're pregnant, or the person is pregnant. And if not, then they're not pregnant at this time. So that's the purpose of this course. We'll be going in great more detail on each one of these specifics. I really look forward to working with you guys in the future. If you have any questions, please don't hesitate to email me, and I will see you guys next week.